Our next speaker is Mary Koffend. She's the owner of Accountable Aging, and she's going to speak on the 3 M's of health insurance. Anybody know what those are? Say them if you know them. Medicare, Medicaid, and Medigap. Mary?
Well, I realize, having listened to most of the speakers today, I'm kind of in a different position than they have been, in the sense that I'm talking about not emotions, although dealing with the government can create a lot of emotions in a lot of people, but it's not quite the same thing, or it's a very different kind of education. But I really am honored to be here, and I want to first of all acknowledge all of you for being here, because I think one of the most important things that we can do in any of this is to learn from what I consider to be experts, because there's so much misinformation out there about all of these subjects, and learning how to deal either as a caregiver, what it's like to have Alzheimer's, what it's like to deal as a caregiver with the emotions today. I've been very impressed with all. And suddenly I got quiet. Okay, not intentionally, because I'm usually a loudmouth. So my next question to all of you, besides saying thank you, is to say, how many of you want to know about Medicare for yourself? Or that's one hand. And if you want to know about Medicare for parents or family members, that's another hand. So for yourself. About half of you, third of you. And for your parents or family members. Great. Okay. How I'm going to do this today is there's a handout on your place, and it looks like this. It's called Healthcare Choices. And there's obviously note pages, and you can write all over this if you would desire, but I'm going to talk about several of these things and then open to some questions about what I've covered, because if I wait till the very end, I may have lost a few of you along the way, and I clearly don't want to do that. So my other thing to say to you right now is to say, why on earth, as the president of Accountable Aging, do you have the expertise to talk about these topics? And one is, if you looked at my bio, you would see that I actually managed the largest Social Security office in Houston for that career and kind of grew up with Medicare. And then I went to work for the Medicaid account in processing insurance claims, and now I'm the president of a company that helps consumers, family members, deal with a multitude of aging issues, including choosing health insurance and dealing with the health insurance choices they've made as they see doctors, see hospitals, need care, etc. So I don't sell insurance in any way, shape, or form, but I feel like I'm really uniquely positioned to be educated, since I now see all the issues that consumers have and make after people have made these choices. So let's talk about the very basics first. Medicare, what is it? So I love it that we have all these alphabet letters for Medicare. Really, they could have done it better than this, but let's just try to get it straight. So you start with Medicare Part A, and that is the coverage primarily for hospital and hospital-related things. And so remember again, this is an insurance dedicated to aging people, so there are no maternity benefits in it, although at some stage 65-year-old women may be able to have children, but not now. But things like skilled nursing. So I don't know how many of you know what skilled nursing is, but it is very useful to us as we age. We may not need it at 65, but we may. It's usually when you have gone for 3 days in a hospital, and there are lots of nuances about all of that. So you really want to read the Medicare.gov website, or if your parent has Medicare, they get a booklet that is about Medicare every year, and it's about half an inch thick and has some great information in it as well. So skilled nursing would be, you've been in the hospital for 3 days, say it's your 85-year-old mama and she's got pneumonia. 3 days in the hospital for an 85-year-old is probably like 10, 20 days for somebody much younger. So before they go home, they frequently go to skilled nursing, which is in a nursing facility, but you get rehab during that period of time, occupational, physical, speech therapy, and lots of effort to make you able to go home safely. And Medicare pays 100% for the first 20 days, and then there's a co-insurance for the second. And I'll talk more. I'm going to use skilled nursing as my example to give you an idea of what it is if you have an Advantage plan versus a Medigap, et cetera, because it's a real easy way to see that. So kind of anything related to hospital is going to come under Part A. There's home health related to hospital, there's hospice, and so those are all the services that come under Part A. And in general, Part A has a large deductible, and it works differently than Part B as far as the cycle is concerned. And I know so much about this that if y'all start to glaze over, I can't see you well here. So would somebody go, wait, you're losing us. So for Part A, it's not an annual thing, it's a benefit period. So the deductible is roughly $1,600 a year for Part A, and that changes every year, and I try not to keep up with the exact dollars, to be honest. But let's say I get into the hospital in January. Had a little minor surgery, I'm fine, I didn't need skilled nursing days, but did I have to pay the $1,600 deductible? Yes. Let us say then in June, I'm in a car accident and I have to go back to the hospital. Do I pay the $1,600 again? Yes. And the reason, that's right, that's why you need to know it's not simple, because a benefit period is one. It starts a new benefit period once you've been out of the Part A system for 60 days. So if you went to the hospital, then you went to skilled nursing, you went to hospice, all under Part A, and then you had another hospitalization without a 60-day gap, then you don't pay that again. But if you have a 60-day gap, you're paying it again. Part B. Part B covers doctors and what we call outpatient services. So that includes, strangely enough, the emergency room, because that really is an outpatient service, labs, outpatient surgery, doctor's visits, etc. And it's based on an annual benefit period. Its deductible is a baby, $150. Payment is at 80% of what the Medicare system says is allowable, and you pay 20%. And that is for the whole calendar year. It also has a premium. Part A has no premium in general. Part B has a premium, and that premium, the government will not make it easy for me when I want to do these presentations, because if you had Medicare last year, the premium was $104.90. If you are just signing up this year, it's around $120. And then there are two places in Medicare where if you have a goodly amount of income, you pay an additional premium amount based on your taxes and some other very complicated formulas, and Part B is one of those. So you could actually pay $240 for Part B. So now I'm going to talk to you, skip on down to Part D. That is the drug coverage that Medicare offers. And I know it gets a bad rap. I've been around for a long time, and the reason I say it gets a bad rap is because I think in general we're not very smart consumers. So if you sign up for Medicare or for most insurance decisions, you don't go back and review those year after year. And for most of us, what we did when Medicare Part D started, we just said, I've loved Blue Cross Blue Shield, or I'm an AARP member, or I went into HEB and they're offering Aetna, or Walmart offered Humana. That I just signed up for it, right? Because I'm thinking it's all the same. Part D is one of the most complicated pieces of insurance to me around. It is very drug specific. And so if your drugs, medications that you're taking change, you need to review it as often as those change. And there is an open season every year in the fall from roughly, y'all are writing so fast, that means good, you're learning new things, thank you. There's an open season every fall, and you get a chance to make a new Part D selection. And clients that we have that my company we feel largely responsible for, whether their son and daughters have authorized us to do it or we work for the trust or whatever, we will look almost annually, depending on whether their medications change, to see how much the insurance company changed their premium, if there are changes in the drugs to be covered on the formulary, if some drugs, I know you all will think this crazy, but this insurance may very well require you to get your doctor to authorize a drug, particularly psychotropics, the ones that we're talking about that treat Alzheimer's. They will ask you to get the doctor to authorize that every time you get it refilled because they're wanting to shift you to a generic a drug that's been on the market a longer period of time, et cetera. But there are plans you can choose that don't have some of those limitations. The average premium for Part D is in the neighborhood of $30, $30, $35. And monthly. I did have a family member not too long ago contact us about, and this is why I say we've got to educate ourselves as consumers, and that's why I'm so pleased that you are here today to hear all the presentations, is that somehow she and her husband had signed up for Part D. He now had Alzheimer's, and they were taking a lot of drugs between the two of them, and their premiums were roughly $110 a month for their Part D. And I said, oh my gosh, why is that? And they said, well, the insurance person or the company we've always dealt with, we just went with their plan. And I said, oh, you need to research these things. You need to either get a good independent insurance agent or come to a company like mine or get a son or a daughter-in-law that's really good at doing computer things and take a look at it. We were able to reduce their overall cost, not only of the plan, but the payout for drugs in the neighborhood of $5,000 a year. So this is why I'm saying you need to be educated consumers. Routinely, we look at our folks, like I said, and almost always we can save, sometimes it's the same plan, but sometimes we can save them easily $500 or $600 a year. And so it's really important to do that. Part D is also one of the places where the federal government has decided that if you have more income, you will pay a higher premium. So both Part B premiums and Part D premiums technically are subsidized by the federal government. And so again, I can't tell you because the premium itself from the insurance company might cost $35, but you might be paying $75 for it if you have a higher level of income. Okay. I want a couple of other things in those arenas. How many of you have heard of the donut hole in Part D? Coverage gap. That's a nicer way to put it, right? Okay, so why I say that stirred everybody up is because we didn't, again, educate ourselves as consumers. We didn't read the fine print. So how Part D works, and if y'all will bear with me, I'm going to go right on the whiteboard for a minute. I'm going to make it really big, hopefully so you can see it from the back. So I'm going to call that 1. Call that column 2. I'm calling this column 3. 1 is the initial cost of the drug, if I could spell. This is the gap. And this I will abbreviate because it's catastrophic. That's too long to write. So if you have any Medicare Part D plan, there can be a deductible or there might not be a deductible. But in this initial phase, you're going to pay roughly 25% of what that drug costs. So if it's a $100 drug, you're paying $25. In the gap, originally, people paid 100% of what the drug cost. So everybody went, oh my gosh, I love getting my drug for $25. When it went to 100, they nearly had a stroke there on the spot. Now, one of the things that happened in healthcare reform is that we're now paying 50% of brand name drugs here, not 100%. But my $25, my $100 drug that was $25 is now $50. And then later, my drug will drop to roughly $5 in catastrophic. And this is why I say it's complicated. Because to move from 1 to 2, it is what I am plus the drug company paying for the drug. And when I have paid and the drug company, roughly $2,800 on my drugs, I move to the next section. And y'all forgive me because I don't memorize these numbers exactly, but they're ballpark. When I alone have paid roughly $5,500 for that, so that counts whatever I paid over here in column 1, plus what I'm paying in column 2. When I reach $5,500, I go to catastrophic and the drug drops to 5 or 10%. When I'm working with a family to help them make a choice, we don't spend any time really talking about this. What we look at is what is the overall cost for the year of the premium plus the drugs, knowing that depending on what drugs you take, you may pay less, more, a lot less, depending on what the circumstances are. I work with a couple of disabled folks that have MS. And if you have MS and those drugs are $6,000 a month, how fast do you think you go to catastrophic? Usually in the first month. This Part D has been just one of the biggest things to help people that really have serious illnesses and have to take terribly expensive drugs. I think that's really, I'm going to stop right now for a second and ask about A, B, and D. Questions? Yes, ma'am.
So the donut hole right there, is that $5,500, is this each individual drug or is this cumulative?
She asked me when you go to the $5,500, it's what you've paid out for the year as an individual at the drugstore. However, if you have drugs not covered, that doesn't count. And that's again, if you look at your plan, there may be some drug you're taking that's not covered at all, and that won't be considered in the calculation. Yes?
I just helped my parents navigate this in December, signing up for the new drug plan, because they keep falling into the donut hole real early on because of specialty drugs for each of them. But once we signed up for a plan in January, the insurance company came out with a list that excluded 5 of their medications after we had signed up for it. So now we've been forced to either order them out of Canada, which is not going to go towards
Right.
the donut, or have them fall into the donut hole, or have the doctor change some of their medications. We were able to get a couple of changes.
I'm going to repeat her question and then give you some ideas. So it can happen that you make the decision in the fall to change the plan, everything looks like it's covered beautifully, and then sometime during the year, the insurance company can say, I'm so sorry, I'm not going to carry, as an example, a company we were working with said, we're not covering Nexium anymore. And I'm Nexium. Couple of drugs that people really, need to take. Anyway, Nexium was not my example. Anyway, it was an expensive drug, and I don't honestly remember the name of it, but you would if I could remember the name. Anyway, the bottom line of the situation is that they have the right to do that. But what I recommend people do, because again, it's in the fine print, and I personally have never lost in helping a family member do this, is you appeal it. Most people don't appeal it. Most people say, they said no and I'm gone. If you will get the doctor to say why that drug is absolutely essential for your parent and you signed up for it in good cause, etc., you stand a really good chance of getting it paid. Yes?
My biggest problem with this system is that whereas private insurance bills you monthly, they'll send you a bill, I get the bill, I pay it. Whereas these Part Ds, Part A, and all that, they bill, the payments come out are due quarterly, but you don't get a bill. So you got to remember to pay. There's a problem if you have Alzheimer's. So that's my issue, and it's not really a question, it's just a statement.
Well, and there is an option to that. The gentleman said he doesn't, sometimes they ask you for quarterly payments, and if you're dealing with some issues of dementia, and just quarterly is not the way most of us work. Most of us work a different way. They may bill you that way, but honestly, I have a number of clients who want to just get it done, and they will be more than happy to accept your annual payment. They'll be more than happy to accept a quarterly payment, even though that is how they do send the statements. Or I don't necessarily recommend it, because if you're going to change the plan often, doing an ACH or direct deposit or online payment, but you can also do it that way. So it's... you know, I tell people you got to pick your fights. You know, and so if I have a lot of people who say, I'll never remember that silly thing, so I'm just going to pay the annual cost of it. I'm going to move on then now to the next section called Medigap. Medigap is insurance, and the plans are set aside by federal regulation. And those, sadly to say, are numbered A through N. Just so we could get more confused, right? And if you looked at them, and there's a lovely, if you go to the Medicare.gov website, there is a great booklet that you can, if you're about to deal with this for your family, a great booklet that talks about Medigap choices. And in it, it has a wonderful chart that says for Part A, for Plan A, don't let me get you confused too. For Plan A, these are the things we'll cover. For Plan B, these are the things we cover. For Plan G, F, H, K, whatever. What is beautiful about this system, which I rarely say about what, having worked as a bureaucrat for a long number of years, is what Congress has done, is that these mesh with Medicare. So let's say, for example, take skilled nursing. What the plans will have is Medicare pays for the first 20 days of a 100-day possibility for skilled nursing. They pay those first 20 days at 100%. The next 80 days, and you don't necessarily get 100 days because you have to continue to be improving, but let's say you could stay 40, 50, 60 days because you had a hip replacement and a complication and you really needed to stay there. Then what would happen is if you had Medigap insurance that paid for that co-insurance, then that co-insurance of roughly $160 a day is paid at 100%. If Medicare decided the co-insurance was $200 a day or dropped it down, moved it up, whatever, the Medigap's going to pick that up at 100%. Whatever the hospital deductible is, as it moves up in cost, it's just naturally going to match with that. So you look at those plans and you say, Medicare doesn't pay for the first 3 pints of blood. It has a co-insurance for this. You pay 20% at the doctor and the ER. These plans will pick up that and match with it perfectly. What's the cons about some of that? One is that you have to, if you want what we call guaranteed issue, you have to sign up for the Medigap at the same time that you sign up for your Part A and Part B benefits. And I'll talk about when those 2 times can be. If you want guaranteed issue, you can buy it later if you are in good health. But again, if you are not in good health, the cost of the premium will be greater. The average premium at age 65 is between $90 and $120 a month for the top of the line Plan F, which is what I laughingly call the Cadillac plan because it pays for everything Medicare doesn't pay for. Now, it has to be part of the Medicare system. So like dental and vision, what we traditionally think of as dental or eyeglass insurance is not covered by Medicare or by a Medigap plan. But the other things that Medicare covers, this will pick it all the balances up, including travel outside the U.S., and if for some reason your doctor decided that he was no longer going to take the Medicare claim and file it himself and said, you pay me and then you're going to get reimbursed, and there, if you're around Medicare, you see there's always that little gap in allowed amount, then a couple of the plans will pay that. So I really highly encourage people to take a look at that. When you turn 65, you will get a stack of mail that is about 4 or 5 inches high over a period of about 6 months. What you will notice is some of these people must have really big mailing budgets because you may get several pieces of mail from the same insurance company on the same day. Most of those are either from Medigap plans, so you can look carefully, or more often they are from these Part C Medicare Advantage plans. So I'm going to finish Medigap and then I'm going to go to Advantage. The only big issue that I see with Medigap is that it increases in cost as you age. So roughly at age 70 and 75 and 80 and 85, your premiums are going to go up. And you can plan on it. It's not just a cost of living, it's a cost because you're going to be using it more, in most cases. So let's say you're in your late 80s, your premium easily could be $200 a month, not the $100 that we talked about at age 65. Questions about Medigap before I go to Advantage? Yes?
So can you talk about the 100 days that you mentioned and that little 60-day, if you're out of the hospital for 60 days, 100 days reloads or something?
So he's asking about skilled nursing benefits. So let's say that you go to the hospital for your 3 required days to have skilled nursing services. And you go then to skilled nursing, and let's say, you know, these things can really happen to people because we see it. They had hip replacement surgery. They go to skilled nursing, and oh my gosh, they got an infection. And then they're back to the hospital, and they're back to skilled nursing. And then, dadgummit, if they didn't get something else happen, and then they're back to the hospital, and they're back to skilled nursing. If you are not out of your benefit, if you're not out of that hospital cycling system there for 60 days, the max you will have is 100. Most people, however, are not caught in that kind of, I call it, medical loop. Most of us, what happens is we have something happen to us, we go to the hospital, we go to skilled nursing, and I have honestly seen one client who had a stroke. We thought she wasn't even going to live. And on the 100th day, because her nephew had sold her vehicle thinking she wasn't living, we got her transported to the used car dealer where she had picked out her vehicle, and she drove away. So that doesn't happen very often, but in general, you have to continue to be improving, and the average that somebody would use in one cycle of skilled nursing is in the neighborhood of about 28 days. Did that answer your question? Good. All right, I'm going to go on to Medicare Advantage. Medicare Advantage started a goodly number of years ago. We call it Part C. So that over there you got A, which is the hospital, B, which is the doctor, and those we call traditional Medicare. Part C we call Advantage Medicare. And I will just be real honest. How many of you sell insurance in this room? Health insurance. Well, if you want to come and have a little discussion with me later, you certainly can. But I'm going to tell you from my consumer perspective the pros and cons clearly of Advantage. In parts of the U.S., Medicare Advantage is really being the primary kind of Medicare people have. The reason is that you get all those mailers at 65. Facilities invite people in to hear presentations about it, all kinds of things like that happen, and it sounds really good. They offer you extras like some dental or vision coverage. They say you will pay no deductibles, and your premium may be $0 or a very small premium, $20, $30, $40 a month. They have a network of doctors, and you usually look to see if your doctor's involved in that network, and you sign up. There is something that all of you should know, and most of you should be old enough to know this. When it looks too good to be true, it is. What happens is that this is like any other HMO, and the difference is that if I'm 45 and pretty healthy, it's not as big a deal as it is to me if I'm 85 and not so healthy. as to whether I can choose any doctor I want, whether or not that doctor or facility will be paid at the same rate that traditional Medicare would pay them. So they've negotiated with doctors and hospitals all over the U.S., depending on your network. And for example, a very well-known company, we just recently had a lady, she went into skilled nursing, and she really was going to need 50 days. And they told us up front from the business office, this insurance plan will pay us roughly the value of 32 days. And that's all we'll be paid. So do you think they were going to keep her 50 days? Do you think the paperwork said you have the same benefits as Medicare? Yes. Did you really? No. I mean, let's just be realistic about it. Is this a good option for people who have limited income and limited resources? Absolutely. The co-pays are less. They couldn't afford the $200 at age 80 for the Medicare Medigap plan, so this is huge for them. It gives them much better coverage, etc. But what I want you to be is an educated consumer. I have so many smart 65-year-olds tell me, actually they're 68 or 69, tell me at 65, I'm healthy. I wanted to take the cheaper plan because when I get older, I'm shifting to the Medigap. How likely do you think that's to happen? Not likely at all. Because how you get a Medigap plan, if you didn't take it at age 65 or your original time, is you have to pass a medical exam. And the cost of the insurance will be based on the medical exam. If you look in the fine print of the Medicare Advantage plans, it will tell you you can switch Medicare Advantage plans in open season again. However, you cannot go to a Medigap plan with what we call guaranteed issue. You're not guaranteed into the Medigap series at the same rate that somebody's been in it from the beginning. And I'll give you a perfect example of what can happen. This lady lived in Georgetown. She actually lived in Sun City. She went to the Scott & White. She signed up for the Scott & White HMO. If you live under the umbrella of Scott & White, that's a wonderful plan. As she aged, she developed Alzheimer's. Her son, who lives here in Austin, moved her to a facility in Northwest Austin. All sounding pretty good, right? Scott & White still serves Travis County. However, neither the geriatric psychiatrist nor the doctor that was visiting that facility was in the Scott & White plan. So he either had to pay out-of-network cost for Mama, or he had to take her out of the Alzheimer's facility to one of the in-office appointments at one of the Scott & White clinics that was covered. I just want you to be educated. I want you to make good choices. If it's cheap at the beginning and you think you're going to effortlessly be able to swap to something like Medigap later, just be aware that there are some places in life at age 65 you're making an important decision for the rest of your life. I get lots of calls from sons and daughters that say, I want my mom out of this Medigap plan because we can't find the skilled nursing or the home health agency that we want to work with that accepts her insurance. And I said, well, you can go back to traditional Medicare, and you can. There's some events under which you can do that, but then you're stuck with the 80-20, you're stuck with the $1,600 deductible, you're stuck with a lot of other charges. So be prepared for that. Questions about Medicare Advantage? Yes, ma'am. Mm-hmm.
He and I read the fine print, as you said, and even though there was no copay with the doctor, if you had to go to a specialty doctor, there was cost involved. Now, I have a diabetic doctor in addition to primary,
This is an educated consumer. What she said is she did some comparison. They were on the other. They looked at some of these plans, and you really do have to look at the fine print. And so I do highly encourage you. I see a lot of people, thank you, that it really is the one thing that they can afford, and it makes a difference. But if you have choices, look at those choices and be educated. I'm now going to talk to you about Medicaid for most of the rest of the time. So what is Medicaid? In the state of Texas, we have 3 primary plans that help people as they age with care. And there are many more Medicaid programs. There's lots of little this and that, but these are the 3 biggies for people who are aged. One is called Community Attendant Services. So let's say your mom's living at home. She's developing mild cognitive impairment. She has limited income and limited assets, and she could use some help in the home. That's what that program is for. It may give you an attendant, and they'll make an evaluation of how much, and of course it's based on all the budget stuff we have or don't have in the state of Texas, but you might get 9 hours a week of somebody coming and helping your mom. They can't drive her anyplace, so compared to the services that are out there at the vendor tables, that's very different. They have all kinds of different liabilities and coverages and help for you, and you pay a higher rate. Obviously, this you would pay nothing because the state of Texas would pick it up. But your person is generally getting minimum wage, and they may or not be as dependable as you would like them to be, but it's certainly great help under the circumstances that they don't have income or assets. The next program is called Star Plus Waiver. And you'd say, geez, could we have a little more descriptive name? We could. It used to be called Community-Based Alternatives, which is a little more descriptive. What that means is the person really needs nursing care, but given certain helps in the home, they could stay in the home and not go to a nursing home. We now call that Star Plus Waiver. And what it would pay for is an attendant, again, at the however many hours they evaluate that your person needs them for. And then it also pays with some medical equipment, and it picks up some of the deductibles and co-pays of Medicare. Very valuable to families. We have a community attendance service. There's generally not a wait list. Community-based alternatives or Star Plus Waiver, there is generally a wait list, 6 months to a year. So if you think your family member is going to need it, you want to get on the wait list. And then the last big Medicaid program we have in the state of Texas, in fact, sad to say, 70% of the people in nursing homes long-term are on Medicaid benefits. And as one lady and I were talking about, the other interesting thing about our population is we're living longer and we're outliving our money. And so we're seeing a goodly number of people who are in assisted livings, and all of a sudden that $5,000 a month isn't there, and they need to move to a next level of care, and so they need to go to nursing home Medicaid. This is my recommendation. This is not law. This is my recommendation to people that contact us for help. Don't wait till the money's completely gone. If you were a nursing home administrator, the best dollars you get come from those Medicare skilled nursing days, because those are the payments that obviously pay for the rehab staff, the extra nursing, et cetera. Then private pay, and then the least benefit you get, and it's significantly less, are the Medicaid dollars. And so if you wait till you gotta have Medicaid, the number of options of nursing homes decrease. Because if you're trying to run a business, could you have 100% of those beds? No, and not have the quality of staff and the kind of staff that you'd want. So you want to go to a nursing home that has skilled, has some private pay, and some Medicaid beds, and there are some very nice ones in all our surrounding area. But I highly encourage, if you think Mama's going to run out of money, that at the stage that she has $50,000 to $30,000 at least, that you say, the next time, Mama, you go to the hospital and need to go to skill days, I'm already going to know the nursing home I want to take you to stay for the rest of your life. So we're going to go in on skill days. Once she's been there for 30 days, you can apply for Medicaid. if she's down, if her dollars are down, or at least you can let the facility know after 3 or 4 more months we're going to need to go on nursing home Medicaid. And it's not, the paperwork is tedious. There's a 5-year look-back period. Do not be putting funds in your parents' checkings account. If you're going to think Medicaid is going to be needed, then I highly encourage you to read as much as you can about it, 1, and 2, this is a place where an elder law attorney can be of great use for you. If there's a house, there's some rules about that. If there's a couple, there are lots of rules about how not to impoverish the spouse who's going to stay at home. So going to a good elder law attorney is excellent. There is a website that lists them, and I don't have that on my paper, but I'll tell you that. It's letters. NAELA. National Association Elder Law Attorneys.org. And it will list the ones we have in whatever county or whatever part of the U.S. your parents might live in. I wanted to cover another quick couple of things. Excuse me. If your family member has low income, there are 2 programs, both for Part D that will pay Part D premiums, and another program that will pay that $104.90 or whatever the Part B premium is, and they're called Medicare savings programs and special needs programs. And if you look on websites for the state of Texas or for Medicare, those applications are there. And it's all related to the poverty level, et cetera, but it's really great if you can get that $104.90 put back into their check or have their Part D premium. But if you just Google that information called Medicare Savings Programs for the premium and special needs for Part D, if you just Google either one of those things, that information will come up, and they're fairly simple applications. When do you enroll? Really, really important. Financially, medically, for your well-being, et cetera. So for Medicare, despite the fact that Social Security's changed the retirement age to closer to 66 and 67, you still sign up for Medicare at 65. And it worries me because I think we get these things disconnected in our head. So at age 65, you would sign up if you are not working where you are covered by an employer group health plan. That's the exception. So I see a lot of us working past 65, working to age 70. If you or your spouse has an employer group health plan, not that you were retired from a place that had one, but that you're still working and still covered, you do not have to take Medicare at 65. You get a whole another window of opportunity with that guaranteed issue for the Medigap if you wish to choose that at that time, as well as for Part D. What I see people doing is panicking. And, and because, you know, I think we're all just kind of nutty about the government anyway, right? I am, and I used to work for them. But you think, oh my gosh, it's 65, I don't know who to ask, I'm going to sign up for A and B, right? That's your moment to also sign up for the Medigap. So you may be paying for A and B, you may be still working and paying an increased amount for B because your income is too high and having full coverage from your employer. So don't panic. Educate yourself about the right moments to do those kinds of things. Questions? Mm-hmm.
And I think I heard you say this, and I think this is what I knew at the time. My husband is covered under my private insurance because I still work.
Yes.
So we did not sign up. I mean, they sent him the A.
Yep.
But we didn't sign up for anything. We'll still get the...
Can still have the full gamut, no penalties, no anything. But now I'm going to tell you a story. I just met with a mama and a daughter. And mama signed up for Part A at age 65, even though she was working still. She worked retail. She didn't have a really big job when she quit work at about 67. She didn't do anything about Part B. There is a huge penalty for each month you don't sign up for Part B if you later on decide you want it. well. She came to visit daughter for Thanksgiving and it accumulated about $25,000 in hospital expenses. And she has no the hospital expenses were covered by Part A, $25,000 in emergency room, doctors, surgery stuff, all kinds of things like that, $25,000 worth of medical expenses. And so in January, February, March of each year, you can sign up if you missed your moment, and it's effective the following July. So we calculated the amount her Part B premium is going to be, and she has very little income. So it's not income related, but it will be almost $300 a month for her Part B because she's 80-something years old and didn't sign up when she quit. So Part D is the same way. If you don't take Part D when you first can take it, there is a penalty to it. Not as significant as the Part B, but it is a penalty. She's asking if you have group insurance, and yes, if you have group insurance that has a good prescription plan, you will get a notice every year after 65 that says you have creditable coverage. And if you have creditable coverage, then when that creditable coverage ends, then you can sign up for Part D without a penalty. That's only the D part. So the B part would be under whether you would get a statement from your employer that said you had employer group health insurance until, I usually see a lot of this, people coming to talk to me about stuff at the end of the year. I'm going to retire at 12/31, I'm 68, I'm 69, I'm 72, whatever it is they are, and saying, okay, can you kind of guide me through what decisions I need to make and how it's going to work? So I know it's the end of the day. Yes. Okay. If you are going to want to do serious Medicaid planning, if you kind of see the handwriting on the wall, and you know, it used to be if you had a $250,000, you thought you were in like Flynn. But if some of these Alzheimer's facilities that are so outstanding are $8,000 a month, your $250,000 can go fast. So if you think you want to talk to somebody about Medicaid planning, the attorneys that have that specialization are called elder law attorneys. They're not estate planning attorneys, they're truly elder law attorneys. So the website is naela.org, National Association Elder Law Attorneys. I'd love it if you guys would look at my website. If you have Medicare questions, look at medicare.gov. And unless somebody's got another pressing question. Oh, yes, I got a pressing question. Oh. You can be first and you can be second.
Medicaid, I understand there's state-run programs, and I've heard on a couple occasions that Mississippi and Texas vie for the 50 worst Medicaid program in the country.
I don't think that the question becomes, because I think the Medicaid programs we have in the state of Texas really serve our people quite well. The issue becomes the total number of dollars devoted to Medicaid. And if you think about 70% of the people in the nursing home being on Medicaid benefits, there are lots of other programs we're trying to look at to keep people in the community and that kind of thing. But I don't think because if you lump in Medicaid, you're lumping in benefits to children, you're looking in all of that. So that's a whole big different arena. But I generally think, do we have plush Medicaid benefits? No. Do we have ones that serve I think our most needy? Yes. That's my perspective. This lady here, and then you.
My question is, my mother is in assisted living, and the facility called an ambulance for her to go 1 mile, and Medicare is refusing to pay for it, even though she's 86 and has Alzheimer's. And I've gone and, Is there anything else that, I'm understanding ambulance and things are,
Ambulance, let's talk ambulance for a few moments. Medicare's definition of your need for an ambulance is it's truly life or death or an emergency. So we had a client, sort of similar. She has she's probably early stage Alzheimer's, and she decided to go out. She lives in an assisted living. They have some beautiful hanging plants in their courtyard, and she decided one needed straightening. And so she's adjusting it, loses her balance, falls on her arm, and breaks her wrist. By definition, that's not an emergency. A broken wrist isn't an emergency. And so they are not likely to pay. Assisted livings have largely, so this is just a place where we all need to be educated. Assisted livings are social models. I don't care what kind of assisted living. They are not a medical model. The only medical models we have are nursing homes. They're the only people that can truly do nursing care. A lot of assisted livings have nurses, etc., but they cannot by law do medical care there. Doctors visit, nurses visit, advise you, but if you got a break or something, what appears to be a heart attack, anything, you're going to the hospital. And it's considered non-emergency. Sorry. I know. Oh, we see them, $800 here, $800 there, yeah. I always want to fight, at least make sure they got all the insurance information, all the justification, but at some stage, you may not win. Yes? You have to talk really louder. I so apologize. Can somebody near her translate for me? Because I didn't hear. For people who draw Social Security disability benefits, you get Medicare after you've been receiving Social Security disability for 24 months. So you do get the same Medicare that somebody at 65 has, and you can choose a supplement. For people who are on the SSI program, which is the program for people with limited income and limited assets. It's run by the Social Security Administration called SSI, where the max payment that you receive is about $750. They naturally get Medicaid as part of that program. And there are lots of other nuances to what you're saying. If you're on Social Security disability and you get Medicare, you can choose a Medigap A plan. Mm-hmm. Yes. I do think, can you tell me how much more time, or do I need to wrap up? Oh, okay. I can't see the clock because of the light. There is a charge for my services. I have to admit, it's taken me 50 years to get this smart. And, you know, it's never ending. I learn every day from the clients that we work with. So our hourly rate is at a minimum $150 an hour. Okay. Yes, ma'am. Medicare is not related to income in any way, shape, or form, other than the cost of premiums. Medicaid is the one that has to do with an income limit. Yep, Medicare has nothing to do with it. If you paid in Social Security, you paid into Medicare and you can have it. We have a client who also, interestingly enough, she suffered from... You know, in the old days, I don't think we'll have, well, we may have this. We may have all our children come home and never work. But in general, she was a young woman who never worked. And her mother worked, her father worked, and they left her trust money. She has children. Her husband was a loser. We don't even know where he is, but she has significant income. But she never paid into Social Security, and her spouse never paid into Social Security. She's divorced from him anyway. So technically, she would not be eligible for Medicare, but you can even buy in to Medicare A and B at age 65. And It costs her a nice penny, but it does at least give her good health insurance. Yes? Absolutely, not their Medicare. So let's get the program straight right away. Social Security doesn't care about your assets. The only reason they might care about your income is to increase your premiums, etc. They don't care about your assets. In fact, the old picture is the three-legged stool for Social Security. So they want you to have assets because Social Security's benefit wasn't meant to be the be-all. Anything to do with Medicaid or SSI is for limited assets. So that is when you want to go before somebody gets any kind of inheritance and meet again with one of these Medicaid specialists, which is an elder law attorney, to get a special needs trust set up. Because then the money can go into that trust and not impact the benefits at all. We work with a lot of families who have young people who were hurt in accidents, some kind of medical malpractice, etc., and get a hunk of money, and that is put in a special needs trust to be used for their long-term care. Well, guys, oh, one more, and then I will close because I know everybody wants to go home.
Okay, so when I turn 65, I'm going to sign up for Medicare.
Are you?
I mean, like, is it something the government provides me, or is it to pay a premium? I mean, I'm kind of confused on the front.
Okay.
I got all this that you're talking about.
Okay. Okay. At age 65, what do you do? If you are not currently covered by an employer group health plan of yours or your husband's, then you may very well want to sign up for Medicare A and B and then make a choice. Do you want the Advantage plan or the Medigap plan to go with it?
So I'm still paying for it.
Yes? Well, very, very reduced. Part A, remember, I said has no premium at all, and Part B is right at $100. You can't get much health insurance for that kind of money. And you get a lot of good insurance for that money. Yeah. I'm going to say one last closing thing about Medicare, and then I'll let you go. There's lots of story that every doctor on the planet is leaving the Medicare system, and that isn't true. However, there are big issues, and again, as a consumer of a general age, you need to be knowing what's happening because healthcare reform has set about changing the payment system for doctors. So for the last 2 years, Congress has gone back in and changed that. So just be aware there are doctors who will take Medicare, there are specialists that will take Medicare, but we are seeing some changes in the system because of reimbursement. So again, educate yourself, educate yourself, educate yourself. And thank you so much for being so interested.